In this episode of the Nurse Practitioner Podcast, Dr. Jeffrey Kwong discusses COVID-19. Can you please provide a brief overview of COVID-19 and the current state of the pandemic in the U.S.?
Absolutely. COVID-19 is the disease or illness caused by the severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2 virus, that results in a flu-like illness. And the range of symptoms can be mild, similar to a regular flu or cold, but other individuals can develop a more severe and life-threatening respiratory syndrome that can require mechanical ventilation. And this is a rapidly evolving and changing pandemic. It was first identified in Wuhan, China, but has quickly spread globally and exponentially. In the U.S., the first case was identified in January 2020, and since then there's been a rapid and exponential growth in the cases all over the United States, with New York being the current epicenter. Internationally and globally, the pandemic has significantly impacted countries including China, Italy, Spain, and Germany. And the data and information are most likely underrepresent the true extent of the pandemic. Many places, including the U.S., have been limited in the ability to appropriately test all individuals. So the true prevalence of the disease is likely much higher than the current estimates of over 400,000 confirmed cases of COVID-19.
Who is at risk for severe disease from COVID-19?
Initially, it was believed that older adults and persons who have underlying chronic medical conditions, such as immunocompromising conditions, may be at risk for more severe outcomes. However, in a new report early March, the CDC estimates that nearly 40% of those patients needing hospitalization were actually between the ages of 20 and 54.
What type of testing is available, and who should get tested?
There are now several different tests available. Every state is different, but most individuals can access a test through local public health departments, commercial labs, and some hospital-based labs. Testing is typically done through a nasopharyngeal swab, and the testing turnaround time varies by lab. The question of who should get tested can vary based on your location and access to services. In New York City, for example, where I practice, testing is now being limited to those who are sick enough to be hospitalized. The local health department is discouraging individuals with presumptive symptoms who are medically stable from being tested. This is in part due to the fact that testing in individuals with minor symptoms may not necessarily change clinical management. Additionally, due to limited resources, testing persons who are asymptomatic or who only have mild symptoms can use up valuable resources such as PPE for healthcare providers. So this may not be the case in all areas or locations, so individuals should really be aware of their local practices and policies.
Is there any type of post-exposure prophylaxis for people who may have been exposed to COVID-19?
That's a great question, and unfortunately, no, there is currently no FDA-approved post-exposure prophylaxis for people who may have been exposed to COVID-19. The current recommendations at the moment are to just monitor for symptoms and to self-quarantine.
If someone is diagnosed with COVID-19, what treatments are currently available?
For patients with mild cases of COVID-19, many patients can be managed with supportive or symptomatic care, including self-isolation, rest, and fluids, and many of the types of treatments that you would recommend for somebody with other viral illnesses. For patients with more severe cases who are hospitalized, more advanced supportive care is warranted, including advanced support for respiratory failure, septic shock, and multi-organ failure. Corticosteroids are not routinely recommended for viral pneumonia or ARDS and should be avoided in patients with severe forms of COVID-19 unless they are indicated for another reason. And as of today, there are currently no antiviral drugs that are licensed by the U.S. FDA to treat COVID-19. There is, however, some in vitro and in vivo studies that suggest the potential therapeutic activity of some agents against related coronaviruses. The two medications, hydroxychloroquine and chloroquine, are oral prescription drugs that have been used for treatment of malaria and certain inflammatory conditions such as rheumatoid arthritis and systemic lupus erythematosus. One small study reported that hydroxychloroquine alone or in combination with azithromycin reduced detection of SARS-CoV-2 RNA in upper respiratory tract specimens compared with the non-randomized control group, but it did not assess clinical benefit. So based upon these limited data, some institutions are now using chloroquine or hydroxychloroquine for treatment of hospitalized COVID-19 patients. There is an investigational intravenous drug called remdesivir with broad antiviral activity that has in vitro activity against SARS-CoV-2 and in vitro and in vivo activity against related beta coronaviruses. It is available through a compassionate use program through the manufacturer Gilead Sciences. And there is little and limited data on the use of HIV antiretroviral lopinavir-ritonavir as well.
Do all patients with confirmed or suspected COVID-19 need to be admitted to the hospital?
No, not everyone with COVID-19 will require admission to a hospital. At this point, most hospitalized patients are those who need higher level supportive care. The decision to monitor patients in the inpatient or outpatient setting should be made on a case-by-case basis. This decision will depend not only on the clinical presentation, but also on the patient's ability to engage in monitoring, the ability for safe isolation at home, and the risk of transmission in the patient's home environment.
If someone is diagnosed with COVID-19 and recovers, what are the recommendations for those patients?
For patients who have recovered from COVID-19, the recommendation to discontinue transmission-based precautions are based on one of two methods. One, a testing strategy, and the other one is a non-testing strategy. The test-based strategy has three criteria. One is resolution of fevers without the use of any fever-reducing medications, and improvement in respiratory symptoms such as cough or shortness of breath, and negative results from an FDA emergency use authorized COVID-19 assay from at least 2 consecutive nasopharyngeal swab specimens collected at least 24 hours apart, so a total of 2 negative specimens. That again is the test-based strategy. The non-test-based strategy, which probably most individuals will need to use because of the limited amount of testing available, is the criteria is at least 3 days or 72 hours since recovery, which is defined as resolution of fever without the use of fever-reducing medications, and improvement in respiratory symptoms such as cough or shortness of breath, and at least 7 days since the first onset of symptoms.
When is a test-based strategy preferred?
A test-based strategy is preferred for hospitalized patients and severely immunocompromised patients, such as those patients who may be on immunosuppressive drugs or who have had a bone marrow or solid organ transplant, somebody with poorly controlled HIV. For those patients who may be discharged to a setting where they will have close contact with other individuals at risk for severe disease, such as those being transferred to a long-term care or assisted living facility, should probably get the test-based strategy.
How can healthcare professionals protect themselves when evaluating a patient who may have COVID-19?
The most important thing as a healthcare worker is to protect yourself with proper use of personal protective equipment or PPE. N95 masks, as well as non-sterile gowns, gloves, and eyewear protection are also recommended at this time.
What role can nurse practitioners play in the pandemic?
Nurse practitioners can play a critical role at this time. For providers in the ambulatory setting, it's important to provide appropriate education and information to patients who may be concerned or calling about COVID-19. For areas or cities that have a shelter-in-place mandate, making sure that patients have appropriate access to medications and routine medical supplies is important, such as making sure that persons living with diabetes have adequate supplies to their diabetic medications and supplies. For many practices, clinicians are also moving to a telehealth platform. This works really well for most individuals, so learning how to do televisits is critical in keeping communication lines open between you and your patients and addressing the health needs of those without COVID-19. And one of the other things that has come up for individuals is the increased anxiety and fear due to COVID-19. I personally have had many patients contact me with concerns of panic, anxiety, insomnia, all of which are based on the COVID-19 pandemic. So being able to spend time with these patients, providing reassurance, has been a critical and key part of managing patients well. I typically try to encourage patients to keep as much of a regular routine as possible. Exercising, engaging with family or friends via telephone or video conferencing, meditation or deep breathing are also great tips to share with patients to help them through some of these difficult situations. However, for some patients, they may require more intensive interventions, such as pharmacologic options, to help them get through this period. And this is something that should be evaluated on a case-by-case basis.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.